Hello everyone, today, it's my pleasure to introduce probiotics restore enteric HDL3 secretion and improve prognosis in patients with end-stage renal disease. End-stage renal disease, ESRD, is the final, irreversible phase of chronic kidney disease, marked by near-total loss of kidney function. In ESRD, the focus shifts from recovery to delaying mortality, with cardiovascular disease, CVD, being the leading cause of death. However, conventional treatments, like statins, have limited effectiveness. To address this, we conducted a randomized, double-blind, placebo-controlled trial to assess the effects of a 6-month mixed probiotic regimen on CVD risk in ESRD. The treatment group showed increased HDL levels, especially the HDL3 subtype, along with slowed CVD progression and reduced mortality risk. A supporting meta-analysis reinforced the prognostic benefits of HDL elevation in ESRD. Mechanistic studies in a murine model revealed that probiotics alleviated arteriosclerosis and myocardial injury through the insulin SP1, P, CYP27A LXR alpha/beta ABCA1 pathway, promoting intestinal HDL3 secretion. These results suggest probiotic supplementation as a novel strategy to reduce CVD risk in ESRD by targeting HDL3 derived from the intestine. To assess the clinical impact of probiotics in ESRD, we conducted a 6-month randomized, double-blind trial with 150 patients. The probiotic group showed significant reductions in oxidative stress, inflammation, and cardiovascular risk factors, along with a notable recovery of HDL, especially the HDL3 subtype, to near healthy levels. Importantly, no cardiovascular deaths occurred in the probiotic group, compared to 6 in the placebo group by the trial's end. These results are consistent with a meta-analysis of 30-year cohort studies showing HDL's protective role in ESRD. To further explore probiotics' cardioprotective effects, we used a murine model of renal injury. In 5/6 nephrectomized OPWIKO mice, probiotic treatment reduced OXLDL and IL-6, while preventing early ARTAC formation. Remarkably, HDL levels normalized within a month in the probiotic group, matching those of healthy controls, without affecting LDL or total cholesterol. These findings highlight the rapid and selective HDL restoring effects of probiotics in renal injury. We explored the mechanism behind probiotic-induced HDL elevation in severe kidney injury and found that probiotics increased ABCA1, a key transporter for HDL production, in intestinal cells, raising HDL3 levels. Our analysis revealed that renal injury reduced the nuclear localization of liver X receptors, LXR, alpha/beta, which regulate ABCA1. Probiotics restored LXR alpha/beta nuclear translocation by boosting intestinal 27-hydroxycholesterol, an LXR ligand produced by CYP27A. Renal injury lowered CYP27A expression, but probiotics reversed this in a dose-dependent manner. Further investigation identified phosphorylated specificity protein 1, SP1, P, as a key regulator of CYP27A expression. Insulin deficiency in nephropathy impaired SP1, P, nuclear translocation, but probiotics restored insulin, facilitating SP, translocation and CYP27A transcription. Probiotics increased HDL3 by enhancing ABCA1 expression through the insulin SP1, P, CYP27A LXR alpha/beta pathway, specific to renal injury. Insulin was identified as a key regulator, with exogenous insulin boosting intestinal HDL3 synthesis in APO/mice, mirroring probiotic effects. In ESRD patients, probiotics raised serum insulin levels at 3 and 6 months, strongly correlating with HDL3 levels. Differences in gut microbiota were observed between ESRD patients and healthy individuals, and gut microbiota also influences insulin secretion. The bacterial species restored by probiotics in mice correlated with insulin and HDL3 in humans, suggesting changes in gut microbiota may impact insulin and HDL3 levels. Summary. Randomized double-blind trials revealed that mixed probiotics significantly elevated HDL3 levels in ESRD patients, slowing CVD progression and lowering all-cause mortality, offering a novel therapeutic approach for high-risk populations. In a 5/6 nephrectomy APO-/- mouse model, probiotic treatment reduced atherosclerotic plaque burden and restored cardiac function, establishing bidirectional clinical basic research validation. This study uncovered a novel metabolic pathway regulating intestinal ABCA1-dependent HDL3 synthesis via the insulin SP1, P, CYP27A LXR alpha/beta axis, defining the molecular basis of microbiome-host interactions that mitigate CVD risk.